welcome back. And we're getting ready to move into our first conversation for today, talking about Caribbean Regional Testing Day. And joining us on set, we have Elio Cabanas, who is the marketing manager for Scotiabank. We have Antonio Coyoc, who is the monitoring and evaluation officer at the Ministry of Health, specifically for the HIV program. And we have Usher, who is the communications and program officer for the National AIDS Commission. Good morning and welcome, and thank you for being here.
Good morning.
Well, for the time being, everybody seemed very relaxed. We know for a fact that that's actually Class A. When it comes to sharing information, you've got to be relaxed. So we know that we've got the 10th anniversary Caribbean Regional Testing Day. This is actually going to be tomorrow, but we'd like to jump more in depth into it as to Testing Day. Talk to us about it.
Well, it's a regional initiative sponsored regionally within 20 countries through Scotiabank. Okay. And Belize is obviously one of those 20 countries. We've been participating for 6 years. And it's basically geared towards getting people tested. The idea again is that generally there is still a bit of stigma with HIV testing, and people want, well, security information, confidentiality kind of things. So we're trying to engage the public, reach out to them, getting everybody tested. And for the first time this year, we have 8 sites throughout the country.
Wow.
Normally we only do 3 or 4 major sites based on our data. But this year we're doing 8 sites, so everybody has an opportunity within almost every community within the country to get tested tomorrow.
Well, that's one way to celebrate 10 years.
Right.
Elio, let's talk a bit about this partnership. You know, this is a very big initiative undertaken by Scotiabank across the region. Let's talk a bit about the history of it.
Right. Well, you know, fortunately for us, we're celebrating 10 years of it. We jumped the bandwagon in Belize 6 years ago, so we're very proud of that participation, and it's really throughout the Caribbean, so most of our branches throughout the entire Caribbean is also on board with this. Yeah. It is really a shining example of private and public sector collaboration, and as Arthur pointed out, the primary purpose is really to increase public participation in voluntary testing and counseling as a way to prevent the spread of HIV by also reducing stigma and discrimination. So it is very important for us. We're very happy to be a part of this important initiative. And tomorrow we'll be having all these testing sites available to try and encourage that participation.
Yeah.
And for Antonio, talk to us about the Ministry of Health participation into this.
Well, with the Ministry of Health, what we do is we usually give all the materials that are used for testing. Okay. And that's something, I mean, it's very costly, but with supporting the National AIDS Commission, that's what we do. All of our different departments that will be out tomorrow, they will be doing the testing, as they rightly said. And we're encouraging everybody to come out, to come out and get tested, especially the males. We're trying to target males to come out. Males come out and get tested. Know your status. That's the theme for this year. Know your status. Yeah.
Now, when you talk about Regional Testing Day, it's always 6 months after the National HIV, the International World AIDS Day. Thank you. That's what I wanted to say. And it's perfect because if you get tested on World AIDS Day, you get tested on Regional Testing Day, and you've met your marker of twice for the year, 6 months.
That's right.
What are we seeing in Belize? And then we're going to look at the region after. But what are we seeing in Belize in terms of the rates of testing for people in the country?
For the rate of testing, for example, if 3 persons would get tested, that would make it, there would be 2 males being positive. All right?
Wow.
So for last year, we had a total of 225 total new HIV cases. And testing, we did a little over 32,000 tests last year.
Yeah. So we are seeing people coming forward voluntarily to test.
Yes.
And in the rest of the region, are we seeing much of the same?
Well, the data does speak to the success of the program.
Yeah.
We are reaching out with the target for 10 years is 100,000.
Okay.
Right now we're about 90,000. So data-wise, we are seeing that people are coming out. Again, the ultimate goal is behavior change and trying to get people to understand the importance of health. Yeah. And getting tested is a part of your health, of course, right? So we try to tie that in a link that the overall health. People come out, diabetes test, pressure check, whatever, but they seem to don't want to do the HIV test. And so making it free rapid and quick, and all these things have helped and gained some momentum in terms of the accessibility of the test, and people wanted to come out, they can do it during their lunchtime, that kind of thing.
Yeah.
So it's easy and it's quick, and so, you know, that I think has helped the public perception in terms of how far we've reached.
And to answer your question to Marlene, according to the report that, or even the presentation that Dr. Edward Green, you know, who's the UN envoy on HIV/AIDS, presented at that Bridgetown meeting in Barbados, he did mention that, you know, after 10 years of decline, that they are seeing a 9% increase. Generally or overall in the Caribbean, and you know, and a lot of it could be attributed to the fact that there is reduced funding from donor agencies, right? That there's also lack of adherence, and so it is important for us to keep that going. And then he also pointed out that only 2 out of every 5 persons know their status within the region, and so it is important for us to keep on pushing for people to know their status, to get tested.
I'm so glad you mentioned that, because that was one of the points I wanted to get at. I think, and most of us, maybe our age or a little bit younger, are accustomed to hearing messages about HIV and AIDS. You know, we had the whole ABC campaign, we have the Know Your Status campaign, and after a while, we've seen less and less of these messages, and I think people make an assumption that perhaps it's under control. There's probably less to worry about. But with the new rise in trends, it shows that there is a need for people to remember that HIV is a potential threat for risky behaviors. So let's talk about what demographics seem to be the most vulnerable when it comes to infections, HIV infections.
Okay, for right now, from the ages of 15 to 49 are the ages that are coming out positive.
Okay.
All right, and
as young as 15.
As young as 15. Wow. And as I was saying before we came on the show, all these persons that are being tested are mostly females, because these are persons that are accessing the health services.
Yeah.
Okay. These are the females that are, for example, if you get sick, you were saying just now, I need to go to the doctor, you know, the females are always the one thinking of going to the hospital to get checked up.
Yeah.
And us males, we tend to be laid back, oh no, we're just going to take something over the counter and just get better.
Yeah.
But these are the numbers. The numbers are actually showing that it's more females getting tested.
You know, I'm right there with you when it comes to health conscious females are much more into it. But I think, and this is from a male perspective, that the scare tactic of going to get tested is actually being injected, because but you know, but at the same time, one of the things that I think would be the scariest part of going to get tested is actually learning or finding out that you're actually positive. So what are we doing, or how can we change the mindset of somebody to say, you know what, life is not, you're not at the end of life to know that you're positive. What are we doing?
Okay. As Marlene rightly mentioned just now, it's something that what's going on is that people are actually coming in, getting tested. Now, you're not hearing much about it. Why? Because it's considered a chronic disease now. It's being put together, for example, like diabetes, hypertension, and so forth. It's combined in these categories. All right. So we would actually give you an advice. I mean, it's not, as you said, it's not the end of your life. What you need to do, you need to adhere to your medication, do your follow-ups, and you could live longer. It's not a death sentence.
Yeah,
right?
yeah. That's a very key message. It is not a death sentence
Yeah.
if you're on medication.
Yeah.
So we're talking, once upon a time, we talked about the vulnerable population being young girls. Then we kind of talked a bit about the men who have sex with men being the vulnerable groups. Who are we seeing now being those who are most vulnerable? You said 15 to 49 as one in terms of age range, but risks that perhaps people are taking, or sex?
Basically, in our what we do is like with the Ministry of Health, we don't target specific groups.
Okay.
We target the population as a whole. So in that aspect, it would kind of be hard for me to mention and to say which groups are more vulnerable.
Yeah.
When going out there for a test, how long does it take for somebody to know, okay, this is your result? How long do you get to a result?
in 5 to 10 minutes.
5 to 10
Wow.
Yeah.
So it's
And
really
all it-
quick.
It's really quick. That's why it's called a rapid test.
Okay.
And all it's done is it's no longer blood is extracted.
I was gonna say, you guys forgot to say the most important thing, right? You don't have to get the big needle anymore.
Right. It's just,
There you go.
Right.
it's just a needle prick that you get, and just a drop of blood is all that's needed.
It's like your sugar test.
Yes,
Right.
Yeah.
yes.
Yes. Right.
Does that put people's minds at ease now when you see them come out for regional testing day and they realize it's just the
Yeah.
press of a finger?
Yeah.
It
So,
does.
yeah, some people usually come and they will stretch their arm out. It's like, no, this is a new procedure. This is a new way of doing it. Oh, okay, fine, let's do it.
Yeah, yeah.
Well, I would say, knowing that now, I'm sure you'll definitely drive a lot of men out to get tested. Now, where are the sites going to be for tomorrow?
Well, we have, let me start from the top. San Pedro will be at the Lions Den. Corozal is at the Central Park. Orange Walk is at the Central Park as well. Mopan, Scotiabank. San Ignacio is at the Welcome Center. Belize City is at Scotiabank on Regent Street. Dangriga is at the Courts parking lot. And PG is at the Central Park.
Okay.
So all times are from 9 to 3 p.m., 9 a.m. to 3 p.m. We do have to mention one of our biggest sponsors this year is BTL as well.
Okay.
They've decided to give out phone cards in each district to the first 50 people who come and get tested.
What?
What?
So again, it's a motivation,
It's
some
an
kind of
incentive,
incentive for people to come out. Recognizing again some of the stigma, some of the fear and things like that. So to alleviate some of this, BTL has decided to partner with us, and they've said,
Are they
well,
also sending their workers? Because that's important.
yeah, they're sending their
yeah.
staff. Right, they're sending their staff.
Yeah.
Again, we can't force anyone to come
No,
out and
no.
do testing, but the campaign is being run through their staff. They will be sending out a text blast to the nation
Okay.
to inform everyone of the activity. So I think that generally, I think businesses and as Ella mentioned, a public-private partnership
Yeah.
throughout the country, people are understanding that we need to partner up to really pull together and alleviate the situation.
Yeah.
If there is an issue of lack of testing, then there might be some resolution in terms of incentivizing people to come out. So I think helping with that is BTL.
I joked with Arthur whether BTL would send out their staff, and because I know that this particular partnership with Scotiabank, it goes beyond just providing funding and location and coordination. You also have kind of a culture within your own company to encourage
Right.
people to get tested.
Definitely,
Yeah.
we do that every year, and it's done throughout our branches. Even in the Caribbean, we play a lead role too in the launching of the event, along with the Caribbean Media Alliance,
Yeah.
as it is now called, from its previous name
Yeah,
and so forth. So that has evolved,
Yeah.
and so we've always been very active in that initiative.
Yeah.
Another conversation that normally comes up, then again, with men, is the fact that for the females, they're always health conscious. They're always out there getting tested, always being tested. And for males, the conversation would be that my girl always to get tested. She's always being tested. My wife is always being tested. So I'm sure that I'm out of I'm negative as well. What do we say to these people?
I guess that's the reason why the theme for this year is know your status, right?
Yeah.
Whether your female is tested, she knows her status.
Yeah.
But you don't know yours, right? So we're trying to get that instilled. No, come on, get tested. Know your status. She knows hers, so she knows where she stands.
Yeah.
But
And only
don't.
you know your sexual history, so it is important for
Right.
you to make sure where you stand.
Yeah.
Because
And I think that's a very important point to discuss. There's still many myths and misconceptions that people have
Right.
about this disease. Let's take an opportunity to address some of them. John spoke about one. That's a very common one. Oh, my partner is tested, and they're negative, so that means I'm fine. But that's not necessarily the case. What are some of the other facts about HIV and HIV transmission that people need to know so they can come out and get tested? Arthur?
In terms of the facts.
Yeah.
Well, I mean, they have the general ones that everybody knows in terms of transmission, mosquito bites and things like that. Mosquitoes don't transmit.
Yeah.
I think the general concerns that people have told us, again, in terms of condom usage.
Yeah.
Or if I use 2 condoms, this kind of thing. I say
2 condoms
doesn't
doesn't work.
That doesn't work.
Yeah.
You know what I mean? So I think for us within the sector and within the response, it's a ongoing conversation.
Yeah.
As well as there is also a lot of valid information through the internet that people can resource, but there's also wrong information, and sometimes people pick up the wrong information for whatever reason. Sometimes following friends, sometimes whatever. Sometimes you just choose to follow the wrong information.
Yeah.
So I think generally in terms of dealing with the myths and how people perceive their sexual history or perceive their sexual acts, I think that in itself is a bit cultural.
Yeah.
And a bit at this stage, I think it has to be an onus, some responsibility on the person itself, on him or herself, to take on that responsibility and say, look, this is my life, this is my health. I need to source this information. I need to be correct in what I'm saying, what I'm doing, how I'm practicing my life. And I think that is where we need to go in terms of behavior change.
Let me ask you, because when you're promoting Regional Testing Day, for the longest time talking about HIV and AIDS has been openly like this, and educating people properly. It's been a bit taboo, because when you're talking about an infection that is transmitted through sexual activity, people start to say, oh, you know, I don't want to go that route, I don't want to hear about that, or perhaps you're being too lewd to be able to talk about the details of it. Are we still seeing the issue where conversations openly about HIV and AIDS are taboo?
A little bit. I think what people fail to realize is that HIV is not only transmitted by sexual contact.
Yeah.
There are a lot of people within the country and young people who are born with the disease.
Yeah.
And there are agencies dealing with that as well.
Yeah.
And so for these people who, no fault of their own, contracted the disease, it should not be a taboo. They have to have a direct conversation every month, every whatever, with their doctor and so forth for the rest of their lives.
Yeah.
So you have those who, yes, contracted through sexual behaviors, and people often cast judgment, which creates a taboo. You know, and so you end up in a situation where, well, I contract the disease through sexual contact, people and judge me, and therefore I don't want to access services because, you know, they might know, this one might know, and that kind of thing. We have a small society. I think these things add to some of our issues, and as I mentioned before, in terms of cultural and how we play out. But targeting and the messaging that we've been saying for the past 5 to 10 years, I think the messaging has changed a bit in terms of understanding the populace and understanding what they know, what they don't know, and we've been trying to target more direct rather than a blame game kind of situation. It's more of a get tested kind of situation, right? So and not casting any judgment, because we don't want to contribute to the taboo. You know, so.
And for the conversations are always out there too, as well, whereby folks would say, if I should get tested and be positive, healthcare might be too expensive. Is that so, Mr. Antonio?
No. Once you're positive and you access the health services, everything that Ministry of Health provides is free of cost.
Wow.
All right, free of cost. You don't need to pay for anything.
Yeah.
All the blood works, all the follow-ups that you do with the doctors, everything is free of cost.
Yeah. And I suppose that's an important part of what you've included in this event. It's not just get your blood test and get your results. There's more to it, right? Tell us about the process.
Okay.
That would be you.
Okay, so they would actually come into whatever area they're going to be tested.
Yeah.
If it's a negative test, then they would be advised to come back in 6 months for World, as you rightly mentioned. World AIDS Day will be back out here, so you could repeat your test.
Yeah.
If it's a positive test, then we would actually refer them to our clinics, and then they would do the follow-up test, meaning a confirmatory test, and then we would refer them to the doctor. If the doctor sees the needs for them to start with the results from the blood, if the doctor sees the need for them to start on treatment, then they will start them on treatment, or else. And then also what plays a lot would be health education, right? Very, very important for them to educate them.
Yeah.
Of course. And because this test, the World Test Day tomorrow, and we want for folks to come on out, what part of the country would we say, and if we are able to mention, would you say would have the highest record of HIV?
Well, the data is saying we have 3 main sites or areas within the country that have the highest would be Dangriga, San Ignacio, and Belize districts. Again, for whatever reason, in terms of socioeconomics or whatever the factors are that contribute to that, but that has been the case for a number of years now, and trying to target that again.
You also have higher testing in these areas as well, don't you?
Right. Well, Belize City again, population-wise, Belize district usually have the most, but just generally information, and again boiling down to culture and how we accept certain things and how we talk about certain things, I think can help. In terms of dealing with the numbers, because we're always, data is always saying, look, these three target, get it done, but. And we don't want to do that and then forget the others, and then you end up with an issue in the other districts. So that's why we're doing nationwide, and anybody can come out and get tested.
And let's talk about the decision to expand. I mean, that's obviously where it came from, because you've done 3 sites, I think it was last year, and now you're going countrywide, right? So is this, tell me why you decided to coordinate this way, who's helping you to be able to do so, and what your hope is with having more testing sites included this year.
Well, I think the initiative came from, again targeting the country. Not a couple of years, other districts have said, well, what about us? Basically, not that they're not doing testing, but to incorporate them into a national or into a regional activity, I think gives some more credence to the issue nationally. So designing the program this way brings everybody into the situation, into the conversation. And I think that was the main focus, to make sure that we have a national conversation. The National Youth Commission is the country's response. And Scotiabank and BTL and the Ministry of Health that are partnered with us for this activity, all see it as a national activity, a national event, a national issue. And so we had to kind of find a way basically to design it like this. And I think it's worked out pretty good. In terms of the collaboration with all the other districts and partners and so forth.
And a perfect way to celebrate that 10th anniversary.
Right.
So let's talk about your award. You guys have been recognized for the effort that you've been putting in each regional testing day.
Right. Well, this award actually celebrates our innovation. Belize is the only country in the region for the past 4 years who has done testing sites prior to regional testing day. So what we've done, we've recognized that again, talking about our gaps in terms of men and getting men tested and all of that. For the past 4 years, we've targeted male-dominated businesses and sites to get them tested. Namely, areas where maybe the guys work shift and they won't be able to come out on regional testing day. So we say, okay, we'll take the test to you guys then. So basically, from May 19th to like yesterday, we were testing the Coast Guard, the police station, the fire station, CPBL, these areas that are male-driven.
1 year you were working with construction workers.
Yeah, we were working with construction workers. We went to Boeing and Boeing, all of these areas. So the PANCAP and the organizations decided to honor Belize this year. Our executive director, Mr. Enrique Romero, went to Barbados to accept the award. And again, it's also a recognition for the hard work that we've done, the partnerships, because to pull together these resources outside of the regional testing day resources is also a feat in itself. And so accomplishing that, I think, speaks to our drive and to the willingness of these companies to allow us in as well. So we also have to say thank you to them.
When it comes to parental, the parental relationship, parents and of course their children, are they, from what you guys have studied, from what you guys have seen, as parents, are we talking a lot to our children about this situation, and are we taking our kids out there to get tested? And I'm talking about your teenagers. You find out now, okay, they're sexually active or they're actually inking themselves. What's going on there?
It's an interesting question.
You said not to ask the hard one.
And we would like to have BFLA too.
Yeah.
But
I think.
And I said this because it's very interesting, and we have to understand that the relationship parents are building with their children right now, it's sort of off at times, especially because of all the gadgets and whatnot. But at the same time, it's very important for parents to talk to their children when it comes to HIV and AIDS.
Right.
And then again, for them to encourage their children, their teenagers or those who they know are active, to go and get tested.
Right. And basically, like I mentioned before, health education plays a huge role. So what we would have the different entities from the Ministry of Health that would actually go to the universities to talk to these students and so forth, right? And the parents would actually give us permission to go in and do these kind of talks, right?
Yeah.
Health talks to the students.
Yeah. And as you pointed out, the vulnerable group does go down to 15 years, so it does show that there is a need.
Yeah.
I don't know if they go with their parents' consent. And that's a serious question to ask. If a university student who's 17 goes out to get tested, will they be turned back?
We usually 17 would be an age that would be admitted to do the test because everything at 18 in Belize is 18 years and above. But 17 we would accept 17 because we actually give them a consent form. Basically, a consent form that is given that they have to read through and sign. Right?
Another thing that would eventually get folks to change their minds about going to get tested outside of World Testing Day would be the conversation that we have with the individual who will eventually do the testing. Is it discreet? What is that process like?
Whenever we would come to do a test, there's what we do, what we call a pre-counseling. We do an intra, meaning while the test is going on, we would counsel you about the actual test, and then we do a post. Right, so there's a process that you take. It's not like, oh, you just come in, I'm going to prick your finger, okay, done. You're negative, go. No, you come in. There's these steps that we take. All right, and it seems that from my experience that doing all this health education and doing all this counseling and so forth, it calls a person to come back. You take your time. You explain to them about the tests. You explain to them about what is HIV, the way it's transmitted, and so forth. But before you start, usually what we do is we question you to see how much you know. If some people would tell you, I don't know nothing about HIV, so that's okay. So you know what? I need to start from the bottom and start. But if some people will go like, I know what's going on. I just need to get tested. I'm like, we still need to do that counseling. We still need to do that counseling for you. Right? So basically, it's a process that you take. Right?
And it also lets people know what behaviors are putting them at risk, because I think people don't always know that as well. What kind of numbers are you looking at for your testing day? You've been doing it for 6 years, so you know how many people you're expecting. Elio?
Perhaps 2,000 would be nice. Last year we did over 1,200. And we only need 91,000 to meet the overall Caribbean goal, which is 100,000 to celebrate this 10th anniversary. And we're at 91,000. So 9,000 more is very realistic. It's likely that we're going to exceed that target. For Belize, we should be able to do the same amount, especially now since we've started that process 6 weeks preceding the big event tomorrow. So that gives us, a good 1,300 again at least to say the minimum. So I think we're right on track in meeting those targets. Now we have all these expanded testing sites. So we are expecting a very good outcome.
What was the response when you went out to the male-dominated workplaces to offer the testing?
It was mixed.
Like go fire.
What I normally do, I don't administer the test, so usually it's administered. But I usually stay outside and talk to the guys and kind of prep them to go in. And so the conversations is where you find all the myths and all the issues outside, and to change that behavior to go in and get them going. But you have those who will willingly come and
talking to them the way you're talking to us here.
No, it's more of a colloquial.
More real talk.
Right. So, but you will have those guys who will go directly. They know they want to, and they're going in, and you have those who don't make up their mind yet. So you have to kind of prep, and that's everybody, male and female. So.
You know, we've seen so many innovative programs in this country when it comes to HIV, and I think we don't talk about them enough. I remember the barbershop training
Yeah.
on HIV education, which, you know, if guys are hanging out in the barbershop and the barber knows the right information, condoms are available, it makes it a bit more comfortable. Are there any new programs that have come on board? This is obviously one, going to male-dominated testing sites, but any others that you think are worthwhile mentioning through the Ministry of Health or other partner agencies?
Through the Ministry of Health, we still have all those programs going on.
Yeah.
Right. It's still ongoing. For now, we haven't had any idea. No idea hasn't struck us as yet what next. You know.
Yeah.
But again, with the numbers that would do with testing, that would give us an indication of what next.
Yeah.
And for tomorrow, or during those testing days that we've got, is it the same process that you that will be followed? Like when you go into a clinic to do a testing, they talk to you. It's in the street.
Yes.
It's from a different area whereby you're being talked to.
Yes, it's the same. It's the same process.
Same process and will be very private and very confidential.
Very important.
And you can get on a phone, can
Right. If
And
you're going
If you're
first,
the first 50.
First
If you're the first 50.
First
So what do you want to tell people about coming out tomorrow to get tested?
Well, like I keep saying from the show started, males, please come out, get tested, know your status. You know, they're the ones we're trying to target, the males. I mean, females welcome to come, but the males are our priority right now.
Yeah.
Stop thinking
So
that
it doesn't matter if your wife, your girlfriend is negative.
Yeah.
If you've had kids
Just about
and
to
they're
say.
negative, you need to be able to get tested and know
Right.
your status for yourself. Because as Elio said, you're the only one who knows your
The
sexual
status,
history.
yeah.
Because when it comes to the percentage, especially like last year, 66% that came out to get tested were females,
Yeah.
and only 34 were males.
Wow.
Right, so that's the reason we're trying to target more males to come out.
All right, and as you mentioned as well, Antonio, if there is a situation where someone tests positive, there is a follow-up
Yes.
care
Yes.
they're referred to immediately.
Yes.
Yeah. Okay. Anything else you'd like to share about this 10th anniversary of Caribbean Regional Testing Day?
come out, get tested. The sites are posted on our Facebook. If
Okay,
anybody wants to
National AIDS
reconfirm,
Commission.
right? National AIDS Commission Facebook. And know your status, guys. It's that important. It's a part of your health, and it only takes 15 minutes. So,
Yeah.
Right, and it goes beyond Regional Testing Day tomorrow. Tomorrow provides an excellent opportunity for everyone to come out from every district.
Yeah.
If you have any questions you want to know, go there and get your test. And this is something that continues throughout the year as a routine.
from 9 to
Just
3.
like any other
9
to 3.
checkup.
9 to
Right.
3 in 8 locations across the country.
country.
The first 50 people to arrive get a free phone card
after getting tested.
after getting tested. Oh, you're gonna show up and get the card.
Yeah,
Okay,
very specific.
I opt out. After getting tested. Very important. And most importantly, we want our men to be able
Yes.
to come out and get tested. They don't have to worry about the needle. It's a fingerprint test. And the results are delivered within 5 to 10 minutes.
5 to 10 minutes. Know
All
your
right.
status. Know your
Okay.
status.
Thank you very much for being here. Congratulations on your award. Congratulations on this relationship that has lasted for 10 years so far, and I'm sure will go longer. And best of luck with the event.
Thank you for having us.
All right, and John, you're going out?
Oh, definitely. I must go on out and because we need to show examples, you know. So definitely we should be out there and take advantage of what they've got to offer. But coming up in just a few, like they mentioned, Digicel will of course partnering. They're actually partnering and giving away phone credits for the 50 people that shows up first after being tested.
Yeah.
And speaking of Digicel, they'll be with us next. Steal deals with Digicel. That's what we'll be chit-chatting about coming up in just a few. Stay with us.